Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what epilepsy is, the causes of epilepsy, what are seizures, types of seizures, seizure triggers, comorbidities connected to epilepsy, diagnosis, and treatment. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link at the top of our channel and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. According to Mayo Clinic, epilepsy is a central nervous system or neurological disorder in which brain activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. Currently in the United States, there are approximately 3.4 million Americans with active epilepsy, 470,000 of them children. Around 65 million people globally are battling epilepsy. According to the American Association of Neurological Surgeons, the following are potential causes for someone developing epilepsy: premature birth, low birth rate, trauma during birth, seizures within the first month of life, abnormal brain structures at birth, bleeding in the brain, abnormal blood vessels in the brain, traumatic brain injury, brain tumors, infections of the brain, stroke resulting from blockage of arteries, cerebral palsy, mental disabilities, seizures occurring within days after head injury, family history of epilepsy or fever-related seizures, late-stage Alzheimer's disease, lengthy fever-related seizures, and alcohol or drug abuse. According to Johns Hopkins, a seizure is defined as a burst of uncontrolled electrical activity between brain cells or neurons that causes temporarily abnormalities in muscle tone or movements, stiffness, twitching, or limpness, behaviors, sensations, or states of awareness. There are many types of seizures. However, they fall under two main classes of seizures: focal onset and generalized onset. Neurologists and epileptologists need to make an accurate diagnosis on what type of seizure is taking place to be able to administer the correct treatment. Partial seizures begin in one area of the brain. They occur mostly due to trauma to one area of the brain, traumatic brain injury, stroke, meningitis. Partial seizures start in one area of the brain and can move to other areas of the brain. Individuals with partial seizures can have auras or warnings that a seizure is going to take place. If the focal seizure moves to other areas of the brain, they can turn into complex partial seizures or focal unaware seizures. People, while having a complex partial seizure, can experience minor shaking, muscle stiffening, fumbling, or chewing. If the seizure stays in one area of the brain, it is called a focal aware seizure or a simple partial seizure. In some situations, focal seizures can spread to the entire area of the brain, causing someone to have a tonic-clonic seizure. Seizures that start in one area of the brain and turn into a tonic-clonic seizures are known as bilateral tonic-clonic seizures. Generalized onset seizures are surges of abnormal nerve discharge throughout the cortex of the brain at the same time. The following types of seizures fall under generalized seizures: absent seizures, brief staring episodes. Myoclonic seizures consist of sudden body or limb jerks that involve the arms, head, and neck. Tonic and atonic seizures cause sudden stiffness in the body, which can cause falls or injuries, known as drop attacks. Tonic, clonic, and tonic-clonic seizures can evolve from a focal or a generalized seizure. Seizures take place in both sides of the brain. Seizure triggers classify things or situations that can result in someone having a seizure. The following are considered a trigger: missed medication, lack of sleep, stress, alcohol, menstruation, physical stress from being sick, dehydration, and flashing lights. Comorbidity describes the existence of more than one chronic illness that an individual can deal with at the same time. The following are conditions that individuals with epilepsy deal with: depression, anxiety, post-traumatic stress disorder, ADHD, cerebral palsy, autism, and bipolar disorder. A neurologist or epileptologist can make a diagnosis from the following. If someone has 2 or more unprovoked seizures, a diagnosis of epilepsy is likely to be made. Electroencephalogram detects abnormal brain wave activity. Computed tomography, CT or CAT scan, looks for any trauma, scar tissue, tumors, or abnormalities that can lead to seizure activity. MRI or magnetic resonance imaging looks for any trauma, scar tissue, tumors, or abnormalities that can lead to seizure activity. There are multiple treatment options for people battling epilepsy. Depending on the type of seizures the person is having or the area of the brain that is being affected, the following treatments may be used: anticonvulsant medications, vagus nerve stimulation, deep brain stimulation, responsive neurostimulation, and surgery. In conclusion, epilepsy is a central nervous system or neurological disorder in which brain activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. A seizure is defined as a burst of uncontrolled electrical activity between brain cells or neurons that causes temporary abnormalities in muscle tone or movements, such as stiffness, twitching, or limpness, behaviors, sensations, or states of awareness. There are different treatments for individuals with epilepsy. Talk to your doctor before making any changes to your medication or treatment plan. To learn more about epilepsy, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.